A warm evening to all. I, Ignatius Roshan, a second-year medical and college chairperson of Indian Medical Association Medical Students Network, Smmch Ri Medical College, Hospital and Research Institute, Chennai. I express my heartfelt gratitude on behalf of the Council to our respected Dean, Dr. Ramanujam Sir, Dr. Kalpana Ma'am, Professor and HOD, Department of Anatomy, Dr. Anandaraj Sir, Professor and HOD, Department of Physiology, for being a pillar of support throughout the event. I would also like to thank Ima Msn Tamil Nadu chapter for providing their platform to present our event. Insula 2020 is an online intramedical college quiz on anatomy and physiology conducted by the IMA MSN Smmch Ri chapter exclusively for the students of Smmch Ri and is sponsored by the Dr. Bhatia Medical Coaching Institute. After challenging rounds of prelims and semifinals, we have found the top 4 teams of the 39 teams who will be competing against each other to back the exciting reward. I take pleasure in welcoming our finalists and the fellow student community to join us in this exciting event. I introduce the quiz masters for Insula 2020, Mr. Manoj and Ms. Sharon, along with Yogeshwaran, who will be presenting the quiz. I, on behalf of the council, wish all the finalists tons of best wishes and good luck. Over to the quizmasters.
Thank you, Roshan. Yogesh, can you please move to the next slide, please? A warm welcome to one and all present here. This is S. Manoj Kumar, the Vice President of the IMA Msn Tn Smmch Ri College Committee. And I would take it an immense honor in thanking with all gratitude Dr. Bhatia Medical Institute, Chennai, for accepting to sponsor our event for the day. And I would like to brief about their institution. So Bhatia Medical Institute has been in service for around 25 years now. They have 150 plus satellite classes across India with 80 plus faculties all over who are taking satellite classes and live classes with many years of experience. And they offer courses for the pre-foundation and foundation as well as for the people who have completed the internship as of now. And I, being a student of Bhatia Medical Coaching Institute, got to know it through my seniors who had been a part of DBMCI. And I really am of the opinion that it is one of the best medical coaching institutes in Chennai, and would really recommend my juniors and forthcoming students to please join the institute. And to give a brief account of what courses they offer is that they give 19 subjects integrated videos with 850 plus hours of conceptual classes in their app, which is called as eGurukul. They have a complete question bank, test series, grand tests, and subject-wise tests, which will subsequently give you an all-India ranking of where you are at the end of the test, which indeed is really helpful for you to know your boundaries and how you can improve upon. And also, lately they have started a program called the Last Minute Revision Program, wherein you can complete the long subjects, say for instance, medicine and surgery in just 25 hours with the complete hard copy of notes you would be receiving. And the faculties are all eminent people from various institutes like AIMS, JIPMER, PGI, etc. For instance, the entire Bhatia team is headed by Dr. Rajat Jain, our radiology professor. For anatomy, we have Dr. Ashwani, Dr. Tamim, who has one of the leading national faculties in medicine in India. And similarly, we have Dr. Praveen for pathology and Dr. Niha for ophthalmology. So I really like to thank Bhatia on behalf of IMA Msn Tn and Smmch Ri Medical College Student Committee for coming forward to sponsor this event. And they have also agreed upon to give us the prizes as displayed in front of you. And also, they would like to give an eGurukul app subscription discount to all the participants who have taken part right from the prelims round. So thank you, Bhatia Institute, and thank you for sponsoring our event. And I have also displayed the student helpline numbers at the bottom of the poster, and would like all of you to please approach me regarding the same. Thank you. And yeah, Yogesh, please move on to the next slide, please. Okay. So now we have something interesting. So I request all the team members to just forget the quiz and all. Imagine you're being given one of these as a prize for your quiz. So I would like the team representatives to please unmute yourself, and as I call you one by one, and tell me which of the following would you like to take. You have biryani, pasta, hot fudge, and an ice cream. So first we'll go with team number 7. Sandhya, are you there with us?
Yeah, can you hear me, Manoj?
Yes. Which one would you like to take?
Hands down biryani.
Biryani. Yeah. So Sandhya takes biryani, and next we have from team number 23, Pavitra.
We will offer ice cream.
You'll take ice cream. Okay. Then from team number 20, Shubha, which one would you like to take?
I'll take biryani.
Biryani is already taken. You can't take that again.
Pizza?
It's done. You have pizza and hot fudge in front of you.
Yeah. Pizza?
Pizza, fine. And so the last with Natesh, you're left with the brownie hot fudge. So this is basically just to choose your teams, the order which we would progress for the quiz today. So Yogesh, kindly move on to the next slide, please. So Sandhya and team, you will be team 1. Yeah, Yogesh, next slide, please. Shubha, you would be team 3. Yogesh, next slide. Natesh and team, you will be team 4. And finally, Pavitra and team, you will be team 2. Yogesh, next slide, please. Okay, I'll quickly repeat the team orders once again. Team 1 will be Sandhya and team. Team 2 will be Pavitra and team. Team 3 will be Shubha Lakshmi and team. And team 4 will be Natesh and team. So are you clear with the team numbers, participants? Any doubts and queries, please let me know right now. Team 1, any doubts?
No.
Team 2?
No, Manoj, we are fine.
Team 3?
No, sir.
And team 4?
No, sir.
Fine. Natesh, please make sure your connection is good. I do have some issues with your voice. Fine. Team 4, are you okay? Team 4, Natesh?
So yes, sir, it's okay. I'll take care of it.
Yeah, fine. Thank you. Okay, I now hand over it to Sharon, who would be hosting round 1. Thank you.
So we have come to the quiz proper at this point in time, and right now we will be seeing the first round of the quiz. It is divided into 2 parts, part A and part B, and part A is called "Come On, It's the Common Stuff." Yogesh, next slide, please. Okay, so this is the description and rules of the round. Each team will get 1 question, which can either be an theory question or an image question. The correct answer will carry 10 marks. In the case of a wrong answer, the question will be passed to the next team. And if the next team answers that correctly, they will be awarded 5 points only. Please note that the time limit for each question is 20 seconds. And as mentioned earlier, the timer will be at the upper right-hand corner of the screen. So if team 1 is fine and good to go, shall we start the first round?
Yeah, Sharon.
I request team 1, the rep, to have their mic unmuted for their round alone. All right,
Oh.
shall we start?
Yeah, we can start.
Yogesh, next slide, please. Identify the clinical condition shown in the given radiographs A and B.
Okay, tell me something.
I'm sorry, team 1, your time is up. This question will be passed to team 2. Team 2, please unmute. Do you have an answer?
We feel it is the first metacarpal spur.
Is that, are you speaking of A or B?
A.
Okay. Do you have an answer for B?
No.
Okay. Unfortunately, I cannot give you marks for this round because you have answered the question incompletely. So, shall we move on to the answer slide? Yes. So the answer for A is Bennett's fracture. It's a fracture of the base of the metacarpal of the thumb. And the image in B was called the boxer's fracture. And it is essentially the fracture of the neck of the second and third metacarpal seen especially in professional boxers. All right. So if team B is ready, if team 2 is ready, shall we go to the second question?
Yeah, we can. Yeah.
Yogesh, next slide, please. Name the condition wherein damage or removal of the somatosensory association area on one side renders the patient oblivious to the opposite side of his body. Team 2, your timer has started.
Contralateral paresthesia.
I'm sorry, team 2, that is the wrong answer. Shall we move on to the answer slide, Yogesh? Yogesh can, yes. So the answer is called amorphosynthesis. I'm sorry. Team 3, are you ready? Shall we move on to your question? One second, Yogesh, hold on a second. 1 second. I'm sorry, 1 second. Okay, we will move on to team 3's question. Team 3, are you ready?
Yeah. Yeah, ready.
Team 3, Yogesh. The most common cause of intestinal obstruction in children between 3 months to 6 years, wherein the proximal part of the intestine telescopes into the lumen of the adjoining distal segment. What is the characteristic sign in the radiology image given below?
Interception.
May I know the sign? Oh, I'm sorry, your time is up. An answer slide, please, Yogesh. Your first part of your question was correct, but you did not answer the sign, which is called the donut sign or the target sign. As a result, 1 second. Yeah, so we'll move on to the next question. Team 4, are you ready?
Yes, ma'am.
Next slide, Yogesh. Please name the peculiar type of action potential generated by the Purkinje cells on stimulation by the climbing fibers depicted in the given image.
Spike potential.
Sorry, that is the wrong answer. You still have time. It's almost correct, but unfortunately, your time is up. Yogesh, next slide, please. Okay, so you almost had answered it correctly. And for that reason, we will be giving you 2.5 marks. Also, team 3, you will be receiving 5 points. If everyone is okay, shall we move on to part B?
Okay.
Okay. Yogesh, can we have the next slide, please? Okay, so the second part of round 1 is called Guess Who. Yogesh, next slide, please. So the rules and description of this round is as follows. Each team will get 1 question. An image of an eminent anatomist or physiologist will be displayed. Each correct answer will be awarded 10 points. 5 points for naming the anatomist or physiologist, and 5 points for stating their contribution. In the case of a wrong answer, the question will be passed on to the next team. The past question will be awarded 5 points, 2.5 for naming the anatomist or physiologist correctly, and 2.5 for stating their contribution. The time limit per question is 20 seconds. If team 1 is ready, shall we go on to their question?
Ready, Sharon.
Okay. Yogesh, next slide, please. Identify and state his contribution.
Sir Robert Edward.
Sorry, that is the wrong answer. Okay, your time is up. So this question is going to be passed to team 2. Team 2, do you have an answer?
Douglas,
I'm sorry, that answer is wrong. Team 3, do you have an answer?
We don't have an answer.
Team 4, do you have an answer?
No, we don't have.
Okay, since nobody has answered, no team gets points for this round. Shall we move to the answer slide, Yogesh? Yes. So this slide is of Arthur Fellow. He described the anatomical characteristics of the tetralogy of Fellow, which is a congenital heart defect causing blue baby syndrome. He stated that cyanosis was not due to a patent foramen ovale, and he attributed the morphogenesis to an intrauterine pathology at the level of the pulmonary valve leaflet fundibulum. Okay, so the next question goes to team 2. Are you ready?
yeah, we are.
Okay, Yogesh, next slide, please. Identify and state his contribution.
William Turner,
I'm sorry, team 2, time is up, and that is also the wrong answer. This question will be passed on to team 3. Team 3, do you have an answer?
No, we don't have an answer.
The question is passed to team 4. Does team 4 have an answer?
Yes, it's Walter Cannon who coined the term homeostasis.
I'm sorry, that is the wrong answer. This question is being passed to team 1.
Helmut.
I'm sorry, that is the wrong answer. Since nobody has answered this question, no team gets any points. We will now move on to the answer slide. Yogesh? Yes. This is the image of Ernest Henry Starling. He postulated the famous Starlings Law, or the law of the heart, which defines a relationship between the length of heart fibers and its power of contraction. Starling, along with Bayliss, was the first to record the electrical activity of a mammalian heart using a capillary electrometer. He played a significant role in the field of endocrinology, coining the term hormone and identifying secretin. If team 3 is ready, shall we move on to your question?
Yeah.
Okay, Yogesh, next slide, please. Identify and state his contribution.
John Hunter. John Hunter.
Yes, can you state his contribution, please?
I don't know.
Time
I just know
ticking.
it's John Hunter.
You still have few seconds.
Vault of construction. Vault of construction.
I'm sorry. Yogesh, next slide, please. The answer slide.
Why are you not passing it?
Because it has already been partially answered. That's why.
Okay.
Yes, team 3, you were correct. That was John Hunter. So you get 5 points for stating the correct name. However, you did not mention any of his contributions, and he has many. Few among them are the ligation of femoral artery in subsartorial canal for popliteal aneurysm. He played a role in in recording the first artificial insemination. He pioneered the development of the smallpox vaccine along with Edward Jenner, and also contributed significantly to the understanding of venereal diseases. So at the end of this round, team 3, you have 5 points for identifying the name correctly. Team 4, are you ready? Shall we go on to the next round?
Yes, ma'am.
All right. Yogesh, next slide, please. Identify and state his contribution. I'm still keeping time. Okay, your time is up. This question, because it was not answered by team 4, will be passed to team 1. Team 1, do you have an answer?
Is it Bohr?
I'm sorry, that's not Bohr. Team 2, do you have an answer?
John Barclay.
I'm sorry, that is incorrect. Team 3, do you have an answer?
No, we don't have an answer.
All right. Since nobody has answered this question, no team gets any points. Yogesh, answer slide, please. Yes. This image is of Sir Andrew Fielding Huxley. As medical students probably know him for his famous sliding filament theory, Huxley and Huxley's. And he also played an important role in proposing the ionic hypothesis, for which he received a Nobel Prize in Physiology for. We are officially at the end of the first round, both Part A and Part B of the finals of Insula 2020. At this point, I would ask Ignatius to say the scores of all teams at the end of round 1.
Yes, then. Now, at the end of round 1, both Part A and Part B, we have Team 1 and 2 having not scored any points as of now. Team 3 leading with 10 points and Team 4 with 2.5 points. All the best, guys. Over to you, Quizmaster. Yeah.
Okay. Congratulations, teams. We now proceed with the round 2. Yogesh, can we move to the next slide, please? Yeah. So this is one of the most revered and the most anticipated round of the event. So it's called Connections. Can we move to the rules slide, please? Okay, so let's have a quick look at the rules. So this particular round, each team will get 2 questions. That is, it will be conducted as 2 rounds. A picture collage will be displayed onto your screen. So you basically need to connect all the pictures and identify the given medical condition or a disease or a named sign. And you have to explain us the clues as to how you arrived at the answer. So each correct answer along with the connected clues will award you a total of 10 points, which is again split up as 5 for identifying the condition and 5 for explaining the clues. In case of a wrong answer, that is, if you fail to identify the condition that is hidden inside, the question will be passed to the next team. And I request you not to start telling out the clues. You tell us the proper answer and then start explaining us the clues. The mere telling of the clues will not fetch you any points as such. And the total time limit for each question is 30 seconds. And in case of a past question, it will be 5 points in total, 2.5 for identifying the condition and 2.5 for explaining the clues. And I again repeat once that the timer will begin as soon as the question is displayed. So does anybody have any doubt at all? Please ask me right away. If there are no doubts, team 1, are you ready for the first question of connections?
Yeah, Manoj, ready.
Okay. Yogesh, please display the first question. Team 1, that's your question. Your time has started already.
Alzheimer's disease.
That's the right answer. Please explain me the clues.
Cerebellar atrophy. First clue.
Yeah, next one.
And can I explain the last clue?
Yeah, please.
That's the disease the lady suffers from in the movie.
Okay, the next 2 clues.
What?
I'm sorry, your time is up. You have identified the condition correctly. So we give you 5 points for that. And since you've told out the answer, the question does not pass to the next team. I'll have a quick review of the answer. So the answer is Alzheimer's disease as given by the first image, which is the cerebral atrophy, which is the characteristic feature. And the second is MMSE, mini mental state examination, which is done for the diagnosis of dementia or Alzheimer's disease. And the second is the histological preparation of the cerebral cortex, which shows amyloid plaques and neurofibrillary tangles. And the last one of the most cringy romantic movies of Tamil cinema, Okay Kanmani, wherein the character showed Bhavani, she suffers from Alzheimer's disease. Yeah, so that's the answer. Yogesh, please move on to the answer slide. Yeah, that was the answer. So kindly hang on. Team 2, if you are ready, we can proceed with your question. Team 2, Pavitra, are you ready?
Yeah, I am ready.
Okay. So Yogesh, please move on to the question slide. Yeah, team 2, here's your question.
Volvulus.
Yeah, that's the right answer. Please explain the clues.
1 second.
Your time is going on, please.
Yeah, the last clue is that he's not able to due to the volvulus.
Time's up. Can you quickly explain all the clues?
Enna sign?
Team 2, do you have an answer?
Spell pannu.
Team 2, we are sorry, your time's up. You had just managed to give us the condition's name. So your answer was perfectly right. It is volvulus. So the first cartoon shows Tom twisting around himself, which is basically how the colon gets twisted against an adhesion. And the second image shows a case of constipation, which is evident in people with volvulus. The third one shows the biliary vomit, which the patients usually have. The fourth image is the important radiological sign, the coffee bean appearance, which is characteristic in people with volvulus. And the fourth image shows a bloated abdomen of the comedian Vadivelu. Yeah. Thank you. You have been awarded 5 points for your answer. Yogesh, please move to the answer slide. Yeah. So team 3, if you're ready, we can move on with your question.
Yeah, we are ready.
Fine. Yogesh, please move to the question slide. Team 3, here's your question. Your time has already started.
It's colon syndrome.
Your answer is correct. Please explain the clues.
So the third clue explains that one side of the body there is a muscle wastage.
Can you be more specific?
Uh,
Which muscle?
pectoralis muscle.
Your time's up. Give me the clues quickly, if you know.
Pectoralis major, there is a wastage of muscle.
Find the second clue. The name of the condition. The last clue. Fine, your time's up. You didn't manage to give us the clues, though your answer was right. So I'll quickly explain. The answer, as you said rightly, is Poland syndrome. The first one shows a map of Europe wherein Poland is highlighted. The second is a case of syndactyly, where the to be more particular, it is only a skin gets joined in this condition. And second is breast and nipple hypoplasia because of absence of pectoralis major muscle. And the last one is a ribcage hypoplasia. All characteristic conditions seen in Poland syndrome. Thank you, team 3. So Yogesh, please move on to the answer slide. Yeah, so team 3 gets 5 points at the end of this round. So team 4, are you ready with us? Can we move on to your question?
Yeah, we're ready.
Fine. Yogesh, please move on to the question slide for team 4. Team 4, that's a question. Your time has started. Do you have an answer, team 4? Your time is ticking.
No, we don't.
You have a few seconds left. Any wild guesses? Fine, your time's up. So question passes to team 1. Sandhya, do you have an answer?
Yeah, it's is it tetralogy of phalid?
That's the wrong answer. I'm sorry. Team 2, Pavitra, do you have an answer?
Transposition of great arteries.
Perfect. That's the right answer. Can you explain the clues, please?
Spring on egg appearance in the radiology.
Correct.
Cyanosis of the kid in the first image.
Okay.
And rapid breathing.
Okay. The last clue.
What does that mean? Wife is changed. The third image.
Okay, we'll give you 5 points for the past answer. You are absolutely right. It is transposition of great arteries. The first image shows cyanosis of the baby. Babies with TGA present with severe cyanosis immediately after birth. The spirometry shows a pattern of tachypnea, and the radiology image is egg on string appearance. And the popular movie scene wherein the heads get switched, so it symbolizes transposition basically. So Yogesh, can you please move on to the answer slide?
Okay.
Yeah, so as a result of this question, team 2 gets 5 points. Okay, so now we start all over again from team 1. Team 1, are you ready for your second round of the question?
Yeah, ready.
Yeah, Yogesh, please display the question for team 1. Team 1, here's your question.
Hypocalcemia.
That is the symptom. We want the condition.
Carpopedal spasm.
I don't want the clues. Please tell me the condition.
Dijot syndrome.
No. You have an answer. Your time is ending. Your time is up, team 1. Do you have an answer for this question?
Total thyroidectomy.
Wait. Team 2, you can't answer now. Team 1, you have an answer for this?
Hypoparathyroidism.
Can you be more specific?
I don't get you. What like specific in a sense?
Connect with the clues. Hypoparathyroidism due to?
Due to the thyroid surgery, thyroidectomy.
Okay, so the answer is iatrogenic hypoparathyroidism due to thyroid surgery, wherein the parathyroids could have been removed. The second one shows Chopstick sign, and the third image shows Trocheo's sign, and the last one, the Big Boss fans out there, the false claim made by Gayatri that she has low calcium in her body. So team 1, I can give you only 5 points for this question.
Yes.
No, because there was some discrepancy wherein the other team had actually get out the answer. So I'm sorry, I can give you only 5 points.
It's not point of argument. Just want to say it was within our time limit, right? So I don't know if other teams interrupt. Like, how is it our problem?
But I'm sorry, the decision of the committee is final. So we can give you only 5 points. I'm really sorry about that.
No problem. Thank you.
Yeah. So Yogesh, please display the answer slide. Yeah, so that was the answer. So team 2, are you ready? We can move to your question.
Yeah.
Okay. Yeah, Yogesh. Next slide, please. Team 2, your question is here. Time has started.
Myasthenia gravis.
Perfect. Can you connect the clues, please?
Second slide is neostigmin, drug for myasthenia gravis.
Okay.
And the third slide is the muscle weakness.
Okay. Next clue.
And third one is first is diplopia.
Fine. Third and fourth and fifth clues, please.
Intubation.
Intubation for?
The respiratory discomfort.
Yeah, and the last clue. Fine. Your time is up. I give you a total of 10 points. It is myasthenia gravis. I'll quickly explain the clues. The first image is diplopia due to the ptosis that occurs in myasthenia gravis patients. The second image is neostigmin, which is a drug of choice for reducing the muscle weakness. And third is the muscle weakness, wherein the patient can actually not even raise his arm above his above his head. And the fourth clue is respiratory failure, which is the most common cause of death in patients due to myasthenia gravis. And the last one is simply depicting autoimmunity. He's beating himself. So that's what is the clue. Yeah. So at the end of this round, team 2 gets 10 whole points. And yeah, Yogesh, please go on to the answer slide. So that was the answer. Team 3, if you're ready, we can move to your question.
Yeah, we are ready.
Fine. Yogesh, please move on to the question for team 3. Team 3, your time has started.
Hypogonadism, primary hypogonadism.
No, that's not the answer. Team 3, do you have an answer? Your time is almost over.
No, we don't have an answer.
Fine. I'm really sorry. The question shifts to Team 4. Do you have an answer for this, Team 4? Team 4, are you with us? Do you have an answer for this question? Sir. Yeah, do you have an answer for this question?
Is it virilism?
No, not exactly. That's one of the clues. The condition as such, do you know? So the question shifts to Team 1. Team 1, do you have an answer?
Klinefelter syndrome.
I'm sorry, that's the wrong answer. Team 2, do you have an answer?
Cryptorchidism.
No, that's the wrong answer. Fine, since none of you have answered, none of the teams get any scores for this particular question. So I'll quickly explain the answer. It is congenital adrenal hyperplasia. I'll explain the clues. The first shows a woman with suffering from infertility. The second image shows a woman with hirsutism. Hirsutism. The third image shows the adrenal glands, which undergoes hyperplasia in this condition. And the last clue shows ambiguous genitalia. That is the genetic females who are born with CAH suffer from ambiguous genitalia. So that's the answer. So Yogesh, can you please go on to the answer slide? Yeah, so that was the answer. So the last question goes to Team 4. Are you ready, Team 4?
Yes, sir.
Yeah, Yogesh, please go on to their slide. That's your question, Team 4. Time has started.
Is it paraplegia?
No. Please tell me the condition.
Syngomalia?
No, I'm sorry. Your time is up. Do you have an answer for this question, Team 4? Do you?
No, sir.
Okay. I'm sorry. Question passes to Team 1. Team 1, do you have an answer?
Is it medial medullary syndrome?
No, I'm sorry. Question passes to Team 2. Do you have an answer?
Amyotrophic lateral sclerosis.
That's correct. Can you please link the clues?
What? Stephen Hawking, the first clue. Wheelchair is the second clue. They will be a wheelchair throughout their life. They won't be able to walk as a second clue.
Okay, the first and the last clue.
Wastage of muscles in the hands.
Okay, and the last, no, I want the condition of the last clue, please.
Hypoplasia. The thenar and the hypothenar eminence. Hypoplasia of the thenar and the hypothenar eminence.
I'm sorry, Team 4, that's the wrong answer. You had managed to give us the name of the disease correctly. It is amyotrophic lateral sclerosis, also known as Lou Gehrig disease. I'll quickly explain the clues. The first image shows a person with complete muscle atrophy. The second image of the movie Thora, wherein Nagarjuna suffers from quadriplegia, which is an unfortunate sequelae of this disease. And the third one is A Brief History of Time, a book written by Stephen Hawking, who himself was diagnosed with ALS. And the last image shows split hand sign, wherein there is the atrophy of the thenar alone, not the hypothenar, as you wrongly said, the thenar muscles, abductor pollicis longus, and the first dorsal interossei. So I can give you only 2.5 answers, 5 marks for your for finding out the condition correctly. So can we move to the answer slide, please? Yeah, so that was the answer. So technically we come to the end of round 2 connections, and I would now request Roshan to please announce the team scores so far.
That was a very interesting round. And at the end of this round 2, as a cumulative score, Team 2 has scored 22.5, Team 1 has scored 10 points, Team 3 has scored 15 points, and Team 4 has scored 2.5 points. Congratulations, guys. Yeah. Over to the quizmaster.
Okay. So we now move to round 3. Yogesh, please move to the next slide. Okay. So this is going to be a very interesting round. It is called as the clinician's cup of tea. So as you would have rightly guessed, this is going to be a case scenario based question round. So we'll have a quick look at the rules. Yogesh, please move on to the next slide. Okay. So each team in this round will get only one question, and each question will be a long clinical case description with or without associated images. So on answering the case diagnosis correctly, you will be allowed to attempt 3 sub questions or 3 theory questions pertaining to the clinical case given to you. Failing to answer diagnosis correctly, you will not be allowed to permitted to answer the 3 sub questions, and your round ends then and there. 20 points straight away will be avoided for finding the diagnosis correctly, and 10 points each will be avoided for answering each sub question. So on total, you can get potentially 50 points for this single round. 20 for finding the diagnosis correctly, and 10 points into 3 for the 3 sub questions. So as far as the timing is concerned, you will have 60 seconds for answering the diagnosis alone. So in the first slide, you'll have just the case and the images, if at all, and you'll be given 60 seconds to answer the diagnosis. And having answered that correctly, we will move on to the subsequent sub questions. Each question will be displayed singly in a slide, and you will be given 20 seconds to answer sub question. Please note, this question of this round will not be passed. You either answer or the round ends then and there. And please, the timer will begin immediately as soon as the slide is displayed. And for want of time, since all these questions are long case-based questions, I will not be reading them. I request you all to kindly concentrate and answer properly. All the best, guys. So team 1, I'm waiting for your response. If you're ready, we'll proceed.
Ready, Manoj.
You don't have any doubts, right?
No, clear.
Fine. Yeah, Yogesh, please move on to the question for team 1. Team 1, that's your question. You have 30 seconds left, team 1.
Berger syndrome?
I'm sorry, that's the wrong answer. Do you have another guess? Your time is almost over. Yeah, please tell me. Team 1, your time is up. Do you have an answer to this question?
No, Manoj.
Fine. So I'll give out the answer. This is a case of postductal coarctation of the aorta. So it is the most common coarctation type seen in adults. And this can be found out by, if you see the radiograph, you can see the characteristic notching of the ribs due to the tortuous dilated arteries. And the characteristic features are hypertension in the upper limbs. And in the periphery, due to the coarctation, there will be a hypotension resulting in very weak peripheral pulses, especially in the leg, which was the clues that we had given in the question. So can you please move on to the answer slide, Yogesh? That was the answer. And since you failed to answer this diagnosis, you don't get any points for this round, and you'll not be able to attend your sub questions also. So Yogesh, please move on to the next slide. Next slide, please. Next slide. Yogesh, come to sub question C and then carefully click on. Yeah, next slide, please. Yeah, wait, hang on, Yogesh. So that was the answers to the sub questions. So team 2, if you are ready, we can proceed with your question.
Yeah, Manoj.
Yeah, Yogesh, please. Team 2, that's your question. You have 30 seconds left.
Ortner syndrome.
I'm sorry.
Syndrome of inappropriate ADH.
That's the right answer. So you get 20 points for the correct diagnosis. So if you're ready, we can move on to the sub questions.
Yeah, we can.
Yogesh, please move on to the answer slide.
Sure.
So that was the answer. So we are now moving on to your first sub question associated with the above case. So Yogesh, please move on to the next slide.
Posterior pituitary.
No, I want the answer in particular. That's the wrong answer.
You want the nucleus? You want the nucleus?
Yes.
Supraoptic.
And?
Paraventricular.
Off.
Hypothalamus.
Yeah, that's the correct answer. You get 10 points for this. So let's move on to sub question B. Yogesh, please move on to the next slide. Team B, do you have an answer for this?
Diuretics.
No. That's the wrong answer.
ADH therapy.
I want the drugs, the name of the hormones. Do you have an answer? I'm sorry, your time is up. We move to the sub question C. Yogesh, please, next slide. Yeah.
ADH levels are high and the plasma
No.
levels of.
We want the name of the criterion. We want the name of the criterion.
Name.
Time's up. I'm sorry, team 2. We can't give you points for that. So Yogesh, please move on to the answer slide. Yeah, so those are the answers. You answered correctly. Supraoptic and paraventricular nuclei of hypothalamus, and the hormones were vasopressin, desmopressin, and oxytocin. The criteria was Schwartz and Bartter clinical criterion. So thank you, team 2. You have got 30 points in total for this particular question. And team 3, if you are ready, we can proceed with your questions.
Yeah, we are ready.
Yeah, Yogesh, please move on to the next slide. Team 3, here's your question.
Answer another. Dijot syndrome.
Yeah, that's the correct answer. Congratulations. You get 20 points straight away.
Okay.
Yogesh, please move on to the answer slide. Dijot syndrome is the right answer. So can you move on to your sub questions?
Yeah, ma'am. Yeah, sir.
Yeah. Yogesh, please display the first question. That's your first question.
Third and fourth pharyngeal pouches.
Perfect. That's the right answer. You get 10 points for that. Yogesh, please move on to the next sub question.
Name the two cardiac anomalies associated with the above condition. Tetralogy of palate.
Yeah, one more.
And one more is we just know the one cardiac anomaly.
Fine, your time is up. I can give you 5 points for that. And moving on to your third sub question. Yogesh, please.
Why is the neonatal most functions and hypoglycemic seizures episodes? Glycemic seizures episodes.
The time is almost up, team 3. Do you have an answer to this question?
No, sir, we don't have an answer.
Fine. So you have got 35 points for this round. So let me quickly explain the answers. Please move on to the answer slide, Yogesh. Yeah, it is a condition of Dijot syndrome wherein the third and the fourth pharyngeal pouches failure to differentiate into thymus and parathyroid glands because the neural crest cells do not migrate into them. And the conditions, cardiac anomalies associated are tetralogy of palate, truncus arteriosus, pulmonary atresia with VSG, interrupted aortic arch, isolated anomalies of aortic arch and VSG. So the reason for the infections is that it's basically thymic hypoplasia, wherein the T cell development will not occur, leading to poor immunity. And hypocalcemia, as you know, is because of failure of parath hormone to be secreted from parathyroid gland. That was the answer to team 3. So team 4, if you're ready, we can proceed with your question.
Yes.
Yeah. Yogesh, please move on to the question for team 4. Team 4, here's your question. You have 30 seconds left, team 4.
Is it adrenal adenoma?
Name the condition, please, not the finding. Time is almost up. Please tell me the name of the condition. Do you have an answer, team 4? Team 4, do you have an answer?
Is it Cushing syndrome?
No, I'm sorry, that's the wrong answer. So the answer is primary aldosteronism or Conn's syndrome. So the most common cause of early onset hypertension, cause of adrenal adenoma, which was the finding shown in the given CT image, or hyperplasia. It is characterized by secondary hypertension and hypokalemia. So you have failed to answer the condition itself, so you can't proceed into the sub questions. So Yogesh, can you quickly go to the answer slide of team 4? Yeah, hang on, Yogesh. So those were your answers, team 4. So we officially come to the end of round 3, which is the clinician's cup of tea. Hope you all really enjoyed it. And I now request Roshan to kindly announce the team's cumulative team scores at the end of round 3.
Yes, Manoj. Now we'll have the cumulative team scores at the end of round 3. We have team 1 with 10 points, team 2 leading with 52.5 points, and closely followed by team 3 with 50 points. And team 4 has got 2.5 points. Congratulations, guys. There's one more round to go. All the best. Over to the quiz masters.
Yogesh, can you repeat the scores? I mean, Roshan, can you repeat the scores?
Yes, sure. Team 1 with 10 points, team 2 leading with 52.5 points, team 3 with 50 points, team 4 with 2.5 points. Hope that's clear.
Thanks, Roshan.
Welcome.
Okay, Yogesh, can we move on to the next slide and round 4? Yes. So we have come to the official final round, and this is the rapid fire round. In the next slide, we'll see the descriptions and the rules. Yogesh, next slide, please. Okay, so these are the rules of this round. I request everyone to pay close attention. Each team will be given a set of questions, set of 8 questions, of which 6 questions will be one-liner theory questions and 2 questions will be image-based questions. For every correct answer, you will get 10 points. And remember that there will be no passing of questions in this round. Okay, you have to answer your set or your team's set. Like I said, only the team the team rep must answer, and when the team representative answers, they must mention the number of the question and answer. For example, 1 answer so and so, or 2 so and so. Okay. Yes, the time for the total set of questions is 80 seconds. But please note this, on the first slide, you will have 6 theory questions. And those 6 theory questions, you must answer in 60 seconds. And only after you answer those 6 theory questions, or after your timer runs out, we will move on to the next slide, which will have the 2 image-based questions. And for those 2 image-based questions, you will get 20 seconds. So hence the total 80 seconds for this round. I'm again repeating, the questions will not be passed. And for you to get full 10 points, you will have to answer every single, like all the answers you have to give. You will see as the round progresses. You cannot give an incomplete answer because no marks will be awarded for that. So complete answers will fetch you full 10 points. 10 points. Please note that you have the opportunity to really get a good score in this round. So if team 1 is ready, we can go ahead.
Sharon, we're ready.
Okay, just a quick reminder for making it easy for taking down the score. Tell the question number and then your answer. I'll tell you whether it's correct or wrong. I will also not be reading the questions of this round because it's already a short period of time and I don't want people screaming questions and me screaming answers and me missing it. So the questions will not be read. The first slide has 6 theory questions for 60 seconds. Team 1, you're up next. Yogesh, next slide, please. Your time starts, team 1.
It's
Come on, team 1, and you can answer out of order also. You can answer 4 first
third
and then
question.
2. Yes.
It's the temporal bone.
Yes.
Uh,
I need all bones. You can skip. You can come back to that question. There are, or
okay.
you can.
First
yes.
question. It's buccal hernia.
Yes.
Third question. It's temporal, frontal, and squamous petrous of sphinx.
Okay, so your time is up for this round. I will announce your score after you answer the image-based questions. Are you ready for the image-based question?
Yeah, ready.
Okay, Yogesh, next slide. Your 20 seconds will start.
Eight is beta wave.
Yes. The first, 7th one, spot diagnosis.
7th is cleft lip along with cleft palate.
No, I'm sorry. A few more seconds. Round closes. I'm sorry. Your time is up. We will move to the answer slide. Answer slide, please, Yogesh. Okay, so you answered the first question correctly, and for that you get 10 points. Unfortunately, you were very close to answering the third question correctly, but you did not complete the answer. Therefore, we cannot award you any points for that. And you did answer the last image-based question correctly. You said beta waves, and for that I will give you 10 points as well. So, therefore, at the end of set A, team 1. At the end of set 1, team 1 has scored a total of 20 points. Team 2, are you ready?
Yeah.
All right. Yogesh, we will move on to the next slide.
Dobbin sign is caused due to subacromial bursitis.
Yes, tell me the sign.
Subacromial bursitis, you can't lift the hand above 90 degrees.
Yes. Can you be a little more specific? That's not the correct sign.
Vendate. Third one is dentate nucleus.
Yes, I need a complete answer. You still have time?
Dentate inguiniform.
No, sorry, the second one's wrong. You still have time. You can attempt another question and come back.
Thailand. First one is inferior gluteal artery. Lateral and medial circumflex femoral artery.
Okay, last one. The one more artery is involved.
Profunda femoris, first perforating artery.
Okay. Yogesh, can we move on to the next slide? Sorry, 1 second. I will tell you your score at the end of the image-based question. I just wanted to mention that. The next slide will have your 2 image-based questions. Yes, Yogesh, we can proceed with that.
Plasma.
Your 2 image-based questions. 20 seconds has started.
What Koeneke hard-off syndrome? Second one.
That's wrong. You have a little more time. Please attempt.
First one is retrograde. Catheter.
No, I'm sorry. Both of those answers were unfortunately wrong. We will move on to the answer slide, Yogesh, and I will tell you your score for this question.
இதை நான் படிச்சேங்க.
Yes, you answered the first question correctly, and for that, and for that question, you get 10 points. Unfortunately, you did guess the condition of the second question, which was subacromial bursitis. But the answer we were looking for is the disappearance of pain when the arm is abducted, not the inability to abduct the arm. You also, I think you accurately
That
guessed
was
one
close, right?
nuclei.
That was close.
Sorry, it's the disappearance of pain and the inability to abduct. I'm sorry, but we cannot give you points for that. And both of your image-based questions, unfortunately, were also wrong. So at the end of this round, you still get 10 points for
Okay.
answering the first question correctly. So team 3, are you ready?
Yeah, we are ready.
All right. Yogesh, next slide. Your time has started. 60 seconds. Thirty seconds left.
Fifth question answer is heparin, histamine, and bradykinin, serotonin. Fifth one answer.
Okay. Any other question? You still have time.
Third one is middle thyroid vein.
Anything more? You still have few seconds.
Second one is internal pudendal vessels and pudendal nerve.
Is that for second? Yes.
Yes, second.
Yes, that is correct. You have answered 3 correctly, the second, the third, and the fifth. We will now move to the image-based questions. Are you ready?
Yeah.
Okay. Yogesh, next slide, please. First one, identify the condition, and second one, identify the type of therapy.
Clavicle is absent.
No, sorry, that's wrong. You still have time.
Eighth one is hypobaric oxygen.
Yes, correct.
Oxygen.
Yes, correct.
Chamber.
Yes, correct.
Eighth
Few
one.
more seconds.
Seven.
Few more seconds. Come on. Okay. I'm sorry. Your time is up. We will move to the answer slide, Yogesh. I will tell you your points, your total score then for this round.
Yeah, okay.
Yes. So since you have answered the second question correctly, the third question correctly, and the fifth question also correctly, you answered 4, which was all what we asked for. And you had also answered the 8th question correctly. At the end of this round, you have a total of 40 points.
I think they answered the third one as inferior thyroid.
They answered a middle thyroid, as far as I've heard.
Yes, they did answer. Wait. They did answer middle
Manoj?
thyroid vein. Yeah.
Actually, we answered middle thyroid vein.
I heard it as well.
Yeah. Okay. All right. Since we have a confirmation for that, for that slight confusion, shall we move on to round 3? Sorry. Shall team 4 answer their set?
Yes, ma'am.
Team 4, you ready? Okay. Yogesh, I request you to go to the next slide. Your 60 seconds have started.
Okay, the fifth question. First neuron is bipolar neuron. Second is the
I'm sorry,
ganglions.
that is wrong. I'll
Ganglions.
stop you there. You still have time to answer more
Okay.
questions. Yes.
Number one is the subphonical organ, paraventricular organ,
We
area
need 4.
area postrema,
What was the second one? Can you please repeat that?
paraventricular,
Okay, can you please go on?
and periventricular.
No, sorry. You can answer another question if you're unsure of that. You still have little more time.
Potassium, fourth question, potassium is 3.5 to 5, sodium is 135 to 145. Creatinine is 0.7 to 1.4.
I'm sorry. I'm really sorry. Your time has ended there. Shall we go to the image-based questions?
Okay, ma'am.
Okay. Yogesh, next slide, please. Yes. First one, identify the condition. Second one, identify the type of apparatus. I'm sorry, your time is up, Team 4. We will now move on to the answer slide. Right. So unfortunately, the fifth question, the first order neurons are rods and cones. The fourth question, you answered the first 2 parameters correctly. The time had gotten over by then. And the first question, you had not completed all 4. So, and also the image-based questions, you had not attempted either of them. So as a result of which you score no points at the end of this set of questions. So we have come to the end of the rapid fire round. I think we will take a few minutes to tally up the score, or if Ignatius is ready, he can announce it straight away.
And now we have the results here. Hope I'm audible. And here we have our glittering winners of Insula. The first place is backed by team number 3, that is Shubhalakshmi, Rishafara, and Samyukta Balkan. They'll be getting a cash prize of 5,000 rupees from DBMCI. The second place is backed by team number 2 with 62.5 points, that is Pavitra B, Surabhi V, and Manikandan. They'll be getting a cash prize of. I'm sorry?
Yes. I'm sorry. I thought I was on.
Pavitra B, Surabhi V, and Manikandan, who will be getting a cash prize of 2.5 thousand from DBMCI. And the third prize is backed by Sandhya S, K Ganesh, Shalini R of Team 1, who will be getting 1,000 rupees cash prize from DBMCI. Congratulations to Natesh, Sriram D, and Arimugan R of Team 4 for participating. I take this opportunity to congratulate all the winners and the participants who have participated in Insula 2020. I once again thank our respected Dean, Sir, and the HODs, of Anatomy and Physiology, Dr. Kalpana Ma'am and Dr. Anandraj Sir, and all the professors of the departments of Anatomy and Physiology for giving us constant support throughout this event. We also thank the council members, Mr. Manoj, Ms. Sharon, Mr. Shahul Amit Sir, Mr. Yogeshwaran, and all the volunteers, that is including VP, Snega B, Manimegalai, Vamshi Krishna, and Vamshi Krishna for being with us, for helping us throughout this event. And also, I thank, last but not the least, I thank Ima Msn Tn for giving us the platform for sharing our first ever college's first ever intra-college quiz. Thank you.
It was a very great effort, guys. It was very meticulously planned and beautifully implemented. We're proud of you, juniors, and our fellow teammates. Our fellow classmates. Thanks a lot for this opportunity.
We kindly request all the participants to please hang on for a few minutes.